A veneer is a thin layer of material that we place over the front of a patient's tooth just to enhance the colour and the shape of the tooth. So generally there's two types of veneers. So there is a composite veneer, which is where the dentist will apply a composite resin onto the surface of the tooth, and then we'll actually mould and shape that to blend it into the tooth structure. And then there's a porcelain veneer, which is where we actually prepare the tooth surface minimally, and we get our lab technician to make a nice thin porcelain veneer which goes over the front of the tooth. So veneers are great for masking any discolorations or uneven texture on the tooth that has been not responsive to, say, tooth whitening. And it can also change it's good for changing the shape of the tooth. So if you've got broken, uneven edges or you've got gaps in between your teeth, they're really good to fill out those. So it's fairly simple. The procedure normally takes about between 2 and 3 visits till you get to your end result. So if a patient is trying to decide whether to get porcelain or composite veneers, there are a few things that they need to take into consideration. So composite veneers are fairly affordable and they can be normally done in 1 visit. The drawback of composite veneers is that they normally last about 5 to 7 years before they start to maybe chip and discolour, and you would normally need to get them replaced. Porcelain veneers, they're glazed and they're hard and they're a lot stronger, so they're resistant to chipping and discoloration, and they generally last about 10 to 15 years, which is a lot longer than the composite veneers. So suppose if I place a composite veneer, I would normally let the patient know that it's a bit of a stepping stone maybe towards getting porcelain veneers.